Hello and welcome back. So today I really want to talk about PCOS and heart health. When it comes to PCOS, there are certain risks that we really need to focus in on that are long-term risks that are associated to this disease. One of the things is increased risk of heart disease. So with PCOS, sometimes we can see that insulin resistance that is associated with PCOS can increase our risk for things like heart disease, such as heart stroke, and a heart attack. This comes from increased cholesterol, high blood pressure, and also, the cause is insulin resistance. Another cause is inflammation. This is something we commonly see in PCOS, and inflammation can actually also come from insulin resistance. So it's very important to actually figure out if you have insulin resistance or not when it comes to PCOS. But what I want to talk about today is some things that can help you to protect your health and your heart health specifically for your long term health. Okay, so first things first is getting some lab work. So here are some markers that are really important when it comes to heart health. Number one is a cholesterol panel. So this will tell you exactly what's going on with your triglycerides, your HDL, which is your good cholesterol, and your LDL, which is your bad cholesterol. Additionally, it'll also give you total cholesterol. So you'll be able to really figure out if your LDL or triglycerides are high. And if that's the case, what really needs to be focused in on is working on diet and lifestyle and to bring these levels down, because if they stay high for many, many years, it can actually increase your risk for things like a stroke or a heart attack. So it's really important to really make sure cholesterol is in check. So the second thing is HbA1c. This is a marker that tells you how well you're able to process glucose over the last 3 months. So it kind of gives you, your sense of how at risk you are for something like diabetes. And so it's really important to focus in on that HbA1c, especially if it's high, really focus in on bringing sugar levels down. And really, you can do that with diet and exercise as well. Homocysteine is also another marker that is important for heart health, and then HSCRP, which is a marker of inflammation. The next two are more specifically for insulin resistance, so a fasting insulin level and a fasting glucose level. This will tell you how much insulin and glucose is in the bloodstream after you've fasted for 12 hours. If it's high, then that means that you have high blood sugar and high insulin, and that can also increase your risk for having something like insulin resistance, and then eventually, down the line, impact your ability to have an increased risk for heart disease. Okay, so this is where all the juicy information comes in now as to like what you can actually do in terms of focusing on protecting your heart. Number one is making sure you eat a whole food type of diet, lots and lots of vegetables, lean protein, good healthy fats, and complex carbohydrates. You want to ensure you're getting enough vegetables because vegetables are packed with fiber, and this actually helps to balance blood sugar throughout the day. You can, get the vegetables in by putting into smoothies. You can roast vegetables like a batch on Sunday and then kind of eat them throughout the week. Make salads throughout the week as well. Really ensure that you're actually getting those vegetables inside your diet, which is extremely, extremely important. Some other foods that are more specific for heart health include things like garlic, which has been shown to help with even reducing blood pressure. Even in supplementation has been shown to reduce LDL, which is our bad cholesterol. So, garlic is a really good one. And then good healthy fats like hemp seeds, flax seeds, chia seeds, all of these contain really good omega-3 fatty acids, which help with, keeping cholesterol in check and also protecting our heart. All right, so let's move on. So the next thing is movement. Exercise is so important when it comes to heart health and also just in general for overall good health. So get yourself moving, even if it's just walking. Walking is so important. Even in diabetic patients, it's been shown that actually walking can really help with insulin resistance and bringing sugar levels and insulin levels down. Last but not least is sleep. Making sure you're getting a really good amount of sleep and good quality sleep is so important. This actually allows our body to be restored and all the organs to kind of be in check for the next day. So if you're having troubles falling asleep, staying asleep, or having difficulties with, getting into that deep sleep, you're waking up not feeling rested, really try to work on sleep hygiene and maybe even consider a sleep study. Oftentimes, we see sleep apnea increased in patients who have insulin resistance. So, it's actually really important to get yourself checked because it's possible that sleep apnea could be one of the issues that can be worked on with, a CPAP machine, but then also with dietary and lifestyle changes. And the last thing I want to mention, and it goes without saying, is that reducing, alcohol consumption or keeping it in moderation and also quitting smoking is so important when it comes to heart health. And it will protect your overall body in general. All right, I hope that was really helpful to kind of get you to understand, how, heart health is associated to PCOS and some things that you can do to protect your heart for the long term. Hope this was helpful, and I'll see you soon.